Hi, this is Dr. Roy Kim, and I'm here with Nurse Practitioner Sophia Kim. She is an amazing injector, and she's clinical director of Skin Detour in Beverly Hills. I'm talking to her because she just came back from Korea for Rejuran Skin Booster Tour. So, Sophia, how are you?
I'm great. Thank you. How are you, Dr. Kim?
I am good. So, I know that you just came back from a trip to Rejuran headquarters in Seoul, Korea. We will be discussing Rejuran, which is a interesting skin booster, and it's not available in the US yet. So, what did you learn at Rejuran headquarters?
So, I had the pleasure of recently attending Rejuran's Global Symposium, where approximately 600 aesthetic and medical professionals from 25 countries from all over the world came together to learn about key aesthetic products, particularly Rejuran. On the first day, we learned about domestic wild salmon from the eastern coast, which is a primary raw material for PDRN and PN, also known as polynucleotide. We also toured the headquarters and their biofacilities, where we observed the advanced processes involved in product manufacturing. On the second day, we sat through lectures given by medical professionals using Rejuran from all over the world who shared the latest insights through lectures and discussions on the clinical efficacy and safety of Rejuran. On the last day, we had a private training session with one of the main Rejuran training physicians in KOL as he shared with us the different methods of treatment techniques that are being implemented in Korea as well as toward his clinic.
Well, that's great. I wish I was invited, and I'm glad, a little jelly that you were able to go. So,
Or maybe
I know that
maybe the
Rejuran's
next
going to
year we'll have the
be
chance.
I know that Rejuran's available in pure PDRN form, which is a nerdy topic, polydeoxyribonucleotide. And they also have a form that's a mixture of PDRN with HA filler, hyaluronic acid. Were you able to see the results and compare them?
Yes, so in Korea, there are four different types of aesthetic injectables that are made with pure PN, also known as polynucleotides, which are used for different indications of the face. These injectables have different viscosity levels. And out of the four, there's a mixture of PN with hyaluronic acid for extra hydration boost and skin regeneration. And additionally, they have a skin booster line that is made with PDRN as well as cosmeceuticals line that's made with PDRN. So there is a difference between PN and PDRN. Unfortunately, I was unable to see the results and compare the products as results occur gradually over time and aren't immediately seen after the treatment.
So PN is different from PDRN. And so, what is the stuff that's actually injected?
The stuff that is actually injected is the PN, the
Oh,
polynucleotide, which is the DNA of the salmon testes.
gotcha. And the PDRN's actually in their skin cream, correct?
Correct.
Gotcha. Okay, so
As
that's
well
an
as their
important.
skin boosters.
Gotcha. So that's an important difference.
Right.
How many treatments are typically needed for the injectable to see optimal results?
So, for injection use outside the US, there is an initial loading dose where it's recommended to have 3 to 4 treatments every month, followed by a maintenance treatment every 6 months or so for optimal results. When used topically as a post procedural serum here in the United States, results should be seen immediately, but multiple treatments will noticeably improve the quality and the health of your skin and combat the signs of aging.
So, with how long did the results of the Regeneron, the injectable, the PN, typically last?
The Rejuran can typically last between 6 to 12 months with optimal treatment.
And then, what kind of downtime or aftercare is recommended following Regeneron injections?
So the downtime for Rejuran injections is minimal. You can expect some redness and swelling at the injection site immediately after the procedure, along with tiny blood marks from the superficial injections that usually go down within 48 hours. Aftercare is similar to that of most other skin treatment procedures, such as avoiding heat inducing activities like saunas and hot yoga for at least 24 hours, avoiding makeup for at least 12 hours, and avoiding harsh or abrasive skincare products for the first couple of days.
God. So are there any contraindications or possible side effects to be aware of with Rejuran injectables?
So Rejuran Healing Essence is safe to use on most patients. There are no known contraindications for topical use. In
Okay.
Korea, Rejuran injectables may not be suitable for pregnant and breastfeeding individuals, those with autoimmune disorders, those who are on anticoagulation therapy, also patients who have a low pain threshold, and those with unrealistic expectations, as Rejuran provides gradual improvements to the skin over time. Some general side effects may include pain upon injection, temporary erythema, edema, and bruising, as with any other injection treatments. And many people ask if Rejuran can be safely administered to patients with seafood or salmon allergies because the component is salmon DNA. And the company confidently claims that due to their proprietary technology known as DOT, which stands for DNA optimizing technology, it allows for the extraction of pure polynucleotide that is free from allergenic protein components. So Rejuran is highly biocompatible and biodegradable, and there have been no issues being reported over the past 10 years since it's first been used.
Got it. So initially you talked about Rejuran Healing Essence. Is that the skincare product?
That is the topical serum that's used in the US, but it's used as an injectable form in Korea and other countries.
Gotcha. I did not know that. Thanks for the clarification. So,
Sure.
how popular is Rejuran injectable in Korea compared to other aesthetic treatments?
So Rejuran is very popular in Korea, where most medical aesthetic clinics offer these products. Rejuran dominates the skin booster market in Korea with 95% market share. So when I was in Seoul, I saw ads everywhere from billboards, bus stops, and even on the front page magazine of Korean Air when I was flying back home.
Wow, that's impressive because Korea has lots of options in terms of the best skincare. Rejuran is 95% market share. That's a lot.
That's huge.
What difficulties do you see for FDA approval for Rejuran injectable?
So getting anything FDA approved is a time-consuming process. Rejuran is already approved in 14 other countries, so I don't particularly think it's going to be a huge challenge other than time, given its efficacy and safety profile.
Now, would you use Rejuran injectable in your practice if it's available in the US?
So Rejuran Healing Essence and their skin boosters are currently available in the US, and I'm using it in my practice as a post-procedural application after microneedling my patients and have been seeing great results. I would use this product if it became available as an injectable treatment in the US. People are traveling all the way to Korea and other countries to get treated, so it'll be nice to bring it into my practice so patients wouldn't have to fly abroad for it.
Gotcha. And so, to be clear to the audience out there that's in the US, the Rejuran injectable is not FDA approved yet. Is that correct?
Correct. It is currently not FDA approved, and they are working on it for
Yeah.
approval.
So you're using the Rejuran Healing Essence in the US is totally, approved, whatever. But it's not technically the Rejuran injectable that you went to Rejuran headquarters in Korea for, correct?
So Korea has Rejuran Healing Essence. So like I mentioned before, they do use it as an injectable so that the Healing Essence is the primary standard product that they have. The one that we have in the US is without lidocaine. The one in Korea has lidocaine. So that's the only difference.
Gotcha. That's good to know. So how do you think Rejuran injectable is going to fit into the current landscape of plastic surgery treatments and aesthetic treatments in the United States?
So Rejuran is a new category called bioregenerators. Bioregenerative medicine, including polynucleotides, is carving out an important niche in the US aesthetics market. There's a growing aesthetic trend shift towards valuing natural beauty that prioritizes skin health. Polynucleotides address the root causes of skin aging, such as tissue degradation and inflammation, making them a holistic addition to existing treatments we have like neurotoxin, dermal fillers, and devices. In the US, combination treatments are a major focus, so incorporating Rejuran will enhance their effectiveness and create synergistic outcomes.
Yeah, I mean, bioregeneration sounds very exciting. When you're in Korea, were there any different things that you saw in Korea that are not available in the US, or maybe treatments that we haven't heard about yet?
Yeah, so there are so many different kinds of Rejuran products made with PN and PDRN, from aesthetic to therapeutic indications. Some of them include injectables that speed up the healing process of open wounds, such as ulcers. They also make intra-articular injections for joint problems, as well as eye drops for dry eyes. In Korea, there's a lot more indications to use Rejuran in different ways for aesthetic treatments. During our clinic shadow day, we observed Rejuran being injected in the entire face, including the eyelids and around the eyes, to treat crepey skin and dark circles, and the neck for skin rejuvenation. We also observed Rejuran being injected into the facial ligaments for ligament support and facial lifting. It was fascinating to see how they use different formulations of Rejuran in different ways in different layers of the skin.
Oh, very cool. So some was injected more superficially and some was injected more deeply.
Exactly. And the
Got it.
technique of the way that it was delivered was not only through needle, but there was cannula, and there was also like a needleless injection method as well, or
Oh, very cool.
administrative method.
So, I mean, I know that Rejuran injectable is from salmon. Now, having said that, was the salmon wild? Is it farmed? And did you go to the salmon farm?
So the salmon are wild and not farmed to ensure they're not exposed long-term to agricultural runoff and other harmful pollutants. On our trip to Korea, we visited the Inland Water Life Resources Center, which is a government-regulated corporation dedicated to the conservation and sustainability of wild salmon populations. This facility operates a conservational hatchery that carefully manages the entire life cycle of wild salmon to ensure their health, quality, and sustainability.
Oh, wow. So it's wild. That's very cool. What other safety protocols are in place for the Rejuran treatments, the Rejuran injectables in Korea?
So Rejuran is manufactured in world-class production facilities, ensuring the quality and safety of medical devices and products. It's Korea FDA approved, Europe CE approved, and officially exported to 14 different countries with local approvals. It has its own patent DOT technology of extraction, which is the most purified hydrolyzing process for polynucleotides.
I mean, that's very cool that they manufacture very high, rigorous standards. Yeah. Are there any final thoughts or takeaways from your experience with Rejuran and Rejuran headquarters in Korea?
I was quite impressed after attending Rejuran's annual Global Symposium. It was really amazing to see firsthand the entire process from Rejuran's raw materials to product manufacturing and packaging. This experience really showcased the company's advanced technology and quality control, letting us understand why Rejuran is being recognized globally.
Very cool. Well, Ms. Kim, thanks so much for talking to me, talking to us about Rejuran. So now I know the difference between PN, PDRN, sort of Rejuran that's available in the US and the stuff that's not available in the US, and then Rejuran skincare versus Rejuran injectable. Is there anything else you wanted to add?
No, I think we covered the bulk of it.
Great. Well, just for all the listeners and viewers out there, Nurse Practitioner Sophia Kim, she's the Clinical Director of Skin Detour in Beverly Hills, California. So definitely I'll leave the information below in the video, but you can contact her office in case you want the latest and greatest injectables, fillers, I mean, everything like that. And she is by far an expert on all those good things. Thanks so much for listening to us. And Sophia, great seeing you as always.
Thank you so much for having me again, Dr. Kim.
Okay. Have a great day.
Have a great day.